Now, patients' default has yet again become a crisis, especially during lockdown. More patients couldn't access medication from their primary healthcare facilities as a result of limited entry due to lockdowns. Defaulting on ARVs is a factor which contributes most to HIV/AIDS deaths in the country. Now, this year's World AIDS Day, the Eastern Cape Health Department is focusing on reversing the default issue. Newzroom Afrika's Sipha Kema joins us now from Komani in the Eastern Cape with Health MEC Nomakhosazana Meth. Very good morning to you, Sipha. Very important as we look at some of the trends we've seen when it comes to accessing ARVs during COVID-19.
Well, certainly, Paul. I mean, when you're talking about access, it's access to primary healthcare. Just your basic services, basically, when it comes to healthcare. Now, I just want to first, before we speak to the MEC, just to give you more about where we are currently. We are in Whittlesea in Komani, where, of course, the health department has set up a mobile services that offers different services, whether it be diabetes, HIV and AIDS, healthcare check, numerous services, but also important to actually give the people opportunity to get access to proper health care and also the medication that they need. Now, judging by the line here, Mpo, that we're seeing here today, I mean, it is crazy. I mean, you saw the line coming from where we are currently, bending all the way, moving all the way down inside. So they're using this tent basically as a setup, a mobile clinic. You know, usually they use the vehicles, but I just want you to look at the size of this tent. Of course, it is to cater to a number of people. Now, Whittlesea, although it is a very small town, it is a rural town close to villages. So you can imagine that sometimes access to primary health care is rather difficult in areas such as these ones here today. And they want to ensure, especially the elders, they want to ensure that they come collect their medication, that they really have the opportunity to do so. Now, we're going to talk to maybe just one or two to find out how they feel here today about the services that they are being given here today. Mola makhulu kunjani? Emakhulu, namhlanje nizofolela ukungena apha ekliniki?
Hayi, ndizowucheka amehlo.
Uzocheka amehlo? Emakhulu, kunzima mama ufumana uncedo ngento edibene nokucedana nempilo apha?
Hayi, kunzima mntana sekhaya. Ngoba kaloku kuthiwa masifole apha. Asiyazi ke ngoku kuthiwa masizele amehlo, umntu azotshikisha loo nto anayo, uyaqonda? Ngoku into eyenzekayo aba bangathi basiphethe ke athini umntu uvela abize umntu ongowakhe athi ngena kanti apha sizowutshekisha impilo yethu. How much kubantu abagaka nathi sasuka siquleke apha.
Mama, and
ibuhlungu le ndlela sibethu kudala silapha.
Usuka kude mama, ilixesha elingakanani ulapha?
Phaa emva ko-5
a.m. mama.
Welala. Okho silapha simile simane sihlala sonyuka sizazi sibona ngabantu sebesithi dungu, asiyazi kwenzeka ntoni.
Ngoku ke mama, ngaphandleni kwanamhlanje ngezinye iintsuku ithini indaba yento edibene nezempilo xa kufuneke uye ekliniki?
Phaya kuthi ke siyaphatha incwadi yakho enenamba yakho nefotokopi yakho uye ekliniki, then ubuze ke ngoba uyenzile le nantsi ke varsity uyaqonda. Okokuqala nakwesibini sinazo ezo ncwadi siziphethe singabanye. Ifoto yakho and then ke ngoku ibe lapha ekhadini lakho.
Ukude mama ikliniki yakho from kule ndawo uhlala kuyo?
Hayi, kudanga kakhulu thina ke siyakwazi uba singhambaze siye thina mama.
All right, and now Mpo, just spoken just spoken to some of the patients, of course, from the area that have been given this opportunity to come and get some services, healthcare services. That is now the old lady that we spoke to, the Makulu we spoke to just now, just told us that she's come to, of course, get her eyes checked. Now, you know, optometrists are rather tricky, thing to get in the rural villages. So when the opportunity presents itself, they make sure to get it. Now, another lady that we spoke to now was complaining about, saying that they've been here since 5 a.m., but they haven't received any form of assistance. So you can imagine the elderly waiting for that long. She alleges that some people are bringing in people they know or familiar with inside before the others who have been waiting here for a while. And it seems as though that is also an issue that does occur at the actual facilities themselves. So she was also giving us just the breakdown of how it works, when you get to a clinic here, where she stays rather. And she says she doesn't stay far. At least she can at least walk and get to her healthcare facility that is close to her at her village. But we were going to speak to the MEC. I think she's still held up, though, at the clinic there ahead here in Whittlesea. She was, of course, talking to the healthcare workers there at that clinic. So I think she's still held up, but we will be able to get her, of course, later on, just to go through some of, the issues that is facing primary health care. Well, rather, access to that primary health care seems to be the main issue here, Mpho.
Very well. Let's leave it there for now, Sipha, Kema, as we monitor what's happening in the Eastern Cape.